Okay, we are live.
Well, thank you everybody for joining us. This is a reschedule of the meeting that was supposed to be held this past Monday, May 4th. We had to reschedule because there were several conflicts that could not be overcome. Joining me tonight is my Director of the Norwalk Health Department, Deanna Diamore. I'm going to make a couple of comments. Let Deanna update you all on the latest information regarding COVID-19, where the city of Norwalk is regarding the number of cases, and unfortunately, the number of people who have passed on. As I mentioned previously, we are looking at a reopen plan for the city of Norwalk. We call it Reopen COVID-19 Reopen Plan. We've been working on that to determine how we can start to ease some of the restrictions that we have in the city of Norwalk relative to our parks, relative to City Hall, relative to other buildings, and so forth. So the plan will be in different stages. In other words, when we reach a certain plateau in the number of cases or the diminished number of hospitalizations, we will enter level 4. The next level would be level 3, the next level 2 and 1. 1 would be the ideal, where we're back to as much normalcy as we possibly can be. And all those other levels will have various easing of restrictions that we have in place. Now, having said that, we still have to work with the state of Connecticut. As many of you know, we were the first city to close down several businesses because of the proximity between the service provider and the client. We also limited the capacity of large box stores and implemented a one person per family strategy. Since that time, the state of Connecticut has also implemented those strategies, and therefore their implementation and the governor's executive orders take priority over Norwalk. And when he eases them, then that will also ease the situation in Norwalk. So we're going to be working very closely and making sure that we're in sync with the governor's plan. And therefore, we kind of tweak our reopening plan almost on a daily basis until we make sure that we have the numbers right, we have the stages right. We want to open in a very, very safe, yet a way that allows people some hope that things are going to start getting back to normal. We know that people are frustrated. We know that we're frustrated, and we want to allow people to have some fresh air exercise and other kinds of things that they haven't been able to enjoy over the past couple of months. So the reopen plan, several parks will be open this weekend to include Cranberry, but not to vehicle traffic yet, Vets Park, the boat ramps, the Fodor Farm, and so forth, and some of the playgrounds. But the playground equipment and the basketball courts will not be open, and there'll be no large gatherings for pickup soccer games or lacrosse or basketball and the like. We still need to maintain that physical distancing because we're not out of the woods yet. We're still in a situation where we're seeing new cases each day. And as I said, I'm going to have Deanna bring you up to speed on that. So when we set these restrictions or ease these restrictions, we're going to require face coverings, still have physical distance, no large gatherings. Playground equipment will be closed. The restroom facilities will be closed, and we're going to start opening those other things gradually. We're hoping that we can open the beach to vehicle traffic on or before May 20th. And when we do open the beach to vehicle traffic, we will have a limited number of parking places. We're probably going to cut the parking spaces down to 50% of capacity. This way we can still somewhat control the situation. We're asking for everybody's willing compliance. As I mentioned earlier, we know this is a very difficult time for everybody. Nobody expected that we would be in this to this degree anytime. The last time we experienced something like this was not we, but the last time our country experienced this, or the world, was back in 1918 with the Spanish flu. And we learn something from them, but we're still writing the manual as we go along, if you will. We're in uncharted waters, we're navigating uncharted waters and trying to make the best possible decisions. Now, as the mayor, I take my responsibility of keeping my community safe, and that is my #1 priority, and I take that very seriously. And I know there's a lot of information out there, a lot of social media, and a lot of opinions, and a lot of things that some people are saying this is not serious. Believe me, folks, this is serious. And while we see perhaps a dim light at the end of the tunnel, it's not as bright as it can be, and it's going to get brighter very slowly. It's kind of like, I liken it to a dimmer switch, where the light has been off, the tunnel was dark. Now we see a glimmer of hope, a little bit of light, and we have to turn that dimmer switch up gradually. Because if we do it too quickly, we're going to increase the spread and we're going to find ourselves back right where we were before. So as I drive around town, I look inside the different stores and I look at things that are happening. And I'm very pleased to say, very proud that most people are adhering to good universal protocols. They're listening to advice. However, there are those that are taking this not very seriously. Now, it's not about an individual. This is not about an individual. It's not about me. It's not about somebody else. It's not about somebody who chooses not to adhere to social or physical distancing, or they want to have gatherings. It's about other people, because if someone who contracts the virus is not asymptomatic, but they have not adhered to good universal protocols, they're going to infect at least 1, 2, 3 other people. Perhaps they're going to infect an elderly parent who has underlying health issues, a grandparent, a sibling. So it's really about other people. So if you feel that you shouldn't be adhering to social distancing or shouldn't be wearing a face covering, think again, because it's not about you. It's about who you might infect and cause. You might even cause somebody's death if you're not careful. So I'm just throwing that out there so people understand just how serious this is. I know, again, I see most people get it, but some don't. And it's the people that don't get it that frighten me. As I started to say, there's a lot of information out there on social media, a lot of opinions, but for me, there's no Democratic or Republican way to deal with this pandemic. There's no need for finger pointing. It's working together, everybody. So I choose to listen to the medical experts, the people who study viruses, the people who know how they trend, the people who know how they spread. They've got a wealth of information, but we still learn new things every single day. So again, I'm asking people, please be responsible, pay attention to the good social distancing recommendations. Please wear a face covering if you're out in public and you cannot maintain physical distance. Please, when you go into any stores, keep your distance from others, wear face covering, adhere to the one-way aisles that the stores have, stand 6 feet away while you're in line to pay at the cashier, and we'll get through this. It's going to happen. It's going to be a little bit, but we're going to do the best we can. We're going to make the decisions that we need to make in order to keep this city as safe as we possibly can. You know, for a while, Fairfield County was the epicenter of Connecticut, and Norwalk was the epicenter of Fairfield County. We know that this is spreading. Other communities have seen the spread sometimes, some more rapidly than Norwalk has. So let's work together. We will get through this. Now, I'm going to turn this over to Deanna Diamore again, who is my director of the health department. We're going to be here for about 45 minutes. After she makes her comments, we're going to open it up to questions and answers. At the bottom of your screen, for those of you joining us on Zoom, there's a Q&A button. You can tap on that and you can type in your question. We'll try to answer as many questions as we possibly can. I have to be off at 7:45 because I have another meeting that I have to attend. So again, thank you all for all that you're doing. Thank you for being responsible. And Deanna, I'll turn the mic over to you.
Thank you, Mayor. Good evening, Norwalk. Thank you so much, Mayor, for all your leadership, for all that you're doing for our city. Our newest case count for today is 1,745, and I'm really sad to report that we've had 101 deaths now in Norwalk. Um, and the mayor's commented about this before, and our hearts go out to all these families, for all the loved ones who are losing loved ones. Our community is suffering a great loss right now. But we're strong, and we're gonna continue to face this, and we're gonna continue to do everything that we can to save every life that we can and to protect the health of our community. So again, thank you, Mayor, and thank you for everyone in the public, all that you're doing. Every time you wear a face covering in public, you're protecting people. Every time you stay 6 feet away from somebody, you're protecting someone. And so thank you so much for everything that everyone is doing. Just to give some updates on the health department and what we're working on right now, we're looking at our resources, and we're looking at moving into the next phase, making sure we have what we need in order to continue to respond to this, because we know it's not going to be going away on May 20th. We're, when reopening starts, as we go into different phases over, the next few months. So we're looking at contact tracing, and that's something that, health departments have been doing, but we need to do it at, in a more in-depth scale, and we need the cases need to continue to go down in order for us to be able to handle the volume of the cases. And so the state health department and all the local health departments are working very closely together at looking at volunteers who can do contact tracing. Many of us have been blessed to have volunteers already supporting us. We've had Norwalk Public Schools nurses helping us. We've had emergency response team members volunteering and helping us. And so we're going to continue to grow the volunteers and our contact tracing capacity, so that as the numbers continue to decrease, then we can do that in-depth, do more and more of that in-depth follow-up with individuals. We also are continuing to respond to different complaints from the public, and just continuing to do follow-up and communications about important health messaging and how to protect yourself and the public. And we also are continuing to distribute personal protective equipment, PPE, to different healthcare providers. And so if you are a local healthcare provider in need of PPE, please continue to contact us and let us know about that need. So those are the major highlights right now, Mayor. Thank you.
Thank you, Deanna. And thank you for all the things that you're doing for the city of Norwalk. Deanna's working from the sun up to way beyond sundown. She's always on the phone. She's trying to get the latest data so we can inform the public exactly where we are. She has built wonderful relationships with the hospital, with the Department of Public Health, with other health directors around the state of Connecticut, and you're doing a remarkable job. So thank you very, very much. The other thing is, we know that City Hall, when we get to level 4, will still be closed to the public, but we'll be doing certain things, providing essential services as we have all along. We're also going to have a window that people can walk up, pay their taxes, and do other kinds of transactions. But if you have any problems with City Hall services, make sure that you dial our community service number at 203-854-3200, or you can dial the department directly. Because of the limited staffing that we have in City Hall, it may take a little bit longer to get an answer, but we ask for your patience. You will get an answer. If somehow your request slips through the cracks, please email me directly. Email my chief of staff, lking@norwalkct.org, or me, H. Rilling, at norwalkct.org, and we'll get the answer that you're seeking. So again, if you want to ask a question, you can do so by clicking on the Q&A at the bottom of your page. The first question is from Donna. Hello, Mr. Mayor. When you open the beaches, would you consider having senior hours? That would be appreciated. I'd love to be able to do that. I don't know if that's something that we can do because of the difficulty with determining who's a senior and who's not. We'd have to have somebody at the gate, but it's an idea. When people come up with ideas, We look at every single recommendation, every single idea. And if we can do it, we certainly will. Or if we can build off of that idea, do something similar to what the request is, we're going to try to do it. So I just want you to know that I've got your question. We're working on how we're going to open the beach and make it as pleasant as possible, yet still control the physical distancing and making sure people are adhering to the universal protocols. So thank you, Donna, for your question. Steph is wondering if the food shortage situation has improved. It's a good question. We are getting food to some people who need it, and we're continuing to work on getting food. However, there's always going to be a food shortage as long as people are out of work and I can't pay their bills, can't buy their food. So we're asking people to get online, donate whatever you can to the food banks, donate non-perishable foods. We can arrange to have a drop-off site for non-perishable foods at the fire departments or other places, because there are a lot of people that that are hungry. Just this past week, we brought in a food truck from Pennsylvania. My wife, Lucia, along with Quarterstone Community Church, St. Philip's, and others, brought in the truck. And it was interesting because the truck broke down on the way back and couldn't get here till 9 o'clock, and some of the food on the truck was perishable. So I reached out to Stu Leonard's. I think I mentioned this before. I reached out to Stu Leonard's, and he provided not only a refrigerated truck, but a staff, a crew to offload the other truck and put the food on the refrigerated truck so we could get it out the next day. Now, we gave it out to a lot of the churches so that they could give it to their parishioners, but some of the people couldn't make it. So we took some food in my car, my wife and I, and brought it to a couple of houses, and brought some, and some people came over to the Cornerstone Community Church. It's hard to believe that in Fairfield County, people are hungry. But even in good times, we have people that are hungry. But right now, when it's a dire situation, and you could have, it would brought tears to our eyes when we handed a box of food to a family, and the look on their face was just one of thanks, of appreciation, and they had tears in their eyes. So yes, there is a food shortage. We have been bringing food in, but we still need more. So thank you, Steph, for your question. Ron, will non-Norwalk residents be able to go to the beach? Because we have a waterfront facility, we cannot keep residents from the beach, or we can't keep non-residents from the beach. We cannot deny them access, but we're working on a plan as we first start opening the beach to limit as much as we possibly can. We're seeking legal advice on that, on how we can best do that. But yes, we're trying to give Norwalk residents the first right to the beach and make sure that they can enjoy it, and have perhaps other areas where non-residents might be able to park and walk in. But yes, we're trying to do everything we possibly can. We recognize that we have a beautiful beach, but legally there are certain things we can do and certain things we can't do. Alice, do you think we are opening too soon? Are we rushing and just asking for trouble? Perfect question. As I said earlier, I'm concerned. I'm concerned that we are trying to open too soon in some parts of the country, in some areas. I think Connecticut is trying to do it right. We're working with our governor and trying to make sure that we don't rush and that we do it right, and still be able to give people some freedom, some liberties, but still also maintain our social distancing and our physical distancing, wearing face masks, and still trying to slow the spread of the virus. Because in Indiana, we had 26 cases from yesterday to today. That means 26 more people in our community now have tested positive for the virus. They probably have infected other people. So we have to be very cautious about how we ease restrictions. And again, we can do everything that we can possibly do, but unless we get willing compliance from some of the residents, it's gonna delay the slowing of the spread. So Alice, we are working hard. We're trying to tweak our reopening plan to make sure that we get it right. As I mentioned earlier, there's no manual for how to handle this. We're writing the manual every single day, but we're going to try to do the best we can and open. And I ask for patience. I ask for the people to be patient, knowing that any decision we made, not only is it difficult, but we're doing it because we believe, based on medical evidence, based on medical advice, the medical experts, we're doing the right thing. We're not listening to the politicians. We're not listening to the Facebook pages. We're not listening. We're doing what we believe is right based on the best advice from the medical professionals, the Center for Disease Control, the Department of Public Health for the state of Connecticut, the World Health Organization. There are medical experts that study this and know what the spread means and how this virus trends. So we're going to be listening to them and trying to make the best decisions. So thank you for your question. It was a very good one. We have Celia. Celia, is there any update on summer sports leagues? Well, again, it's going to be situational where we are at any given time. I'm not sure you're going to see organized sports to any great degree this year. We're going to have to make those decisions, but we're talking about these issues on a daily basis. So who knows what the situation is going to be like on July 15th. Or on August 1st. We're going to do everything we can to keep our community safe, but also recognize that our young people need healthy, engaged activities, and we know that they need exercise. But I can't answer that question right now. I'm not optimistic that we will have any significant number of organized sports leagues this summer, but let's see what we can do. Councilman David Hoovelman. Thank you, David. Nice comment. He's saying, thanks for doing these and looking good, guys. So thanks, David. And David, I want to thank David publicly because David, on a daily basis, publishes things on his Facebook page, and it's good information. He publishes information that we put out, plus he has other information that he puts in there. So David, that's what your constituents expect from you, and you're doing a bang-up job yourself. So thank you very much. Kelly, can someone explain what exactly contact tracing is and how it helps? Deanna, I'm going to pass that off to you.
Sure. So contact tracing is something that public health departments have been doing, for years and years and years. It's part of what we do. So if you think of, with different infectious diseases, it's a matter of identifying who is tested positive and interviewing them and getting all the information about where they've been, at when was symptom onset, getting who they had been in contact with at different days to determine when they were infectious, so that we can get information about the spread of the disease so that we can first isolate the person that's sick and have them understand, that they need to stay home and they need to be isolated from others for a certain period of time, and also identify those, it's called contacts, those who they were in contact with while they were infectious. So who could they have potentially exposed to the virus, and then identifying those people and then having them be under a quarantine. So isolation is for those who are sick and quarantine are for those who have been exposed. And so following up with both the person who is positive to see how they're doing, and then following up with all those contacts of that positive person, making them understand that they need to be under quarantine, and then following up with all of those people every day to see how they're doing, to see if they've developed any symptoms, and then go from there to see then if other people start to develop symptoms, or if they have, then who are those contacts? So it's important. It's an important tool for infectious disease. It's a matter of being able to control the spread of that infectious disease.
Thank you, Deanna. I'm going to pass the next two questions on to you as well. The first one is antibody testing something members of the public should seek out?
So we're still, the Connecticut Department of Public Health, other infectious disease experts, they're saying to be cautious about them at this point. There's still a lot that we don't know about them. They are being used for research right now, for public health surveillance, to get an understanding of different communities and how widespread but COVID-19 has been, but they aren't recommending it at an individual basis at this point. We still don't know if someone has been infected in the past, whether they could get infected again or not. There's still a lot to be known about them. So I'm actually hoping within the next couple of weeks we'll have more clear guidance on that. But they are being used right now for surveillance to get an understanding of the spread of this disease. But on an individual basis right now, there isn't a clear recommendation, at this point. Still more to learn about them.
Thank you, Dana. And then the next question, can you also talk about new criteria for leaving isolation after testing positive?
Sure, I'd be happy to do that. So the CDC actually just updated that recently. Previously, they have they have based on your symptoms and then also based on testing. And so they've looked at research recently. They've done a lot of in-depth look at, how long someone they think would be infectious for. They've looked at how, when they think that the virus could, when you're still infectious. So based on this new research, they found that they believe that 10 days is the cutoff for symptoms. So if you develop symptoms, it used to be 7 days. Now they're expanding it to 10 days. So 10 days past the start of symptoms, also have to be fever free for 72 hours without any, medication to reduce your fever, and your symptoms have to be improving. So it's a change from 7 to 10. And they still have a test-based strategy, but they're now saying there's no preference for using, for the general public for a test-based strategy versus the symptoms. Because what they're finding is that a lot of people are still testing positive weeks after they've had symptoms. And that's because that PCR test, that test to see if you have the disease or not, is a very sensitive test. So it will pick up even weeks after when you still are the CDC doesn't believe you're infectious at that time. And so now they're saying they're recommending you can also look at symptoms. And so they're saying 10 days past symptom onset, 72 hours fever free, and improvement of symptoms.
Thank you, Deanna. Great answer. And now the next question, Megan writes, thank you both for your great leadership. Thank you for the nice comment, Megan. We've got a great team in place. We've got a wonderful team that's working hard every single day. I'm saying we're on the phone early in the morning till late at night, and we deal with issues as quickly as we possibly can, trying to anticipate some of the things that may be happening and dealing with issues on a daily basis. We try to be as proactive as we can in making our decisions, but this is a situation sometimes that requires a reactive approach, where the more we get information and we have to react to it quickly and decisively. And making those decisions is sometimes very difficult, as I've said, but they have to be made. And I'm very proud of the people in Norwalk for all their cooperation and how they're responding to this. But I also want to thank my team, who's doing a tremendous job. I see it firsthand. You see the results. I see the actions. So again, thank you. Walter, is there any update on plans for a high school graduation? I know that there's been discussions at the Board of Education meetings and other meetings that we've had and conference calls, the possibility of having some sort of a drive-in graduation. I'm not sure how the logistics of that would work, but I know that we're trying. We're trying to figure out how we could have a graduation. Every year when I go to the middle schools, I go to 4 middle schools in rapid succession and congratulate all the young people who are being promoted into high school. And the day before that, I usually do a Brian McMahon High School or Norwalk High School. Having been a graduate of Norwalk Public Schools, Norwalk High School myself, I know how important it is for young people to have a graduation. It's a very special time in their life. And this is a very disappointing thing to many of them, not only the graduation, but their high school proms. These are things that you look forward to for 12 years, and nobody can anticipate that this was going to happen. So rest assured that we're going to try to do something to help at least some sort of a graduation or some sort of a celebration of graduating from school and moving on into the next stage of your life. So stay tuned, and we'll try to do whatever we can. Next question is from Linda. Thank you, Mayor Rilling, for these updates. I continue to pray for you and your family and our entire community. Thank you, Linda. There's a power in prayer, and prayer and faith. We will get through this. We'll get through it together. We're going to get through it, and when we come out on the other side, we're going to be stronger for having gone through this. So let's keep our prayers coming. They're much appreciated, Linda. So thank you. Let's see, Joe, I haven't seen a graph lately, but are hospitalizations, intubations, and infections increasing, decreasing, or holding steady? We have a meeting every Thursday morning at 9 o'clock, and we did this morning, and we have people on from the hospital, the AmeriCares, and so forth. So that topic, I believe, has been on our radar. So I'm going to ask Deanna to answer that.
Sure. So, the governor releases that information every day with updates, and there is, the hospitalizations have been on a decline over the past 2 weeks. So, yes, that continues to get better and improving in terms of, the capacity, and we're seeing, less people being hospitalized.
Yes, and those are some of the things that are going to guide us as we go through our reopening plan, go from level 4 to 3 to 2 to 1. We have to make sure that we are where we want to be before we move to that next level. Because as mentioned earlier, are we rushing? Are we going to be opening too quickly? That's a danger. So we want to see a reduction in hospitalizations, intubations, infections. We want to see fewer cases, and we're always praying that we don't have any more people passing. These are all members of our community. It's heartbreaking. They leave behind, they're taken from us too soon, and they're leaving behind loved ones. Families are brokenhearted. This is a very, very difficult time for everybody. So we're hoping that we can get through this. So thank you for the question, Joe. Let's see the next question. Gwen, how are you handling jury duty summonses? Well, there's no court cases going on right now. There is no jury duty. So I can only imagine that if you've gotten a jury duty notice, you look on the information part, there's probably telephone numbers that you can call for your local geographical area. And it will probably, if there's anybody that will answer, they'll probably explain that the jury duty summons that you have is null and void until we can get back to having court open again. So I wouldn't really worry about it. I don't think you have to worry about anybody coming and picking you up and bringing you into court. But just look on your summons if you did get one, and see if you have a telephone number that you can call or a website that you can check. If you look on the state judicial website, they'll probably have a lot of information as well. Ben, and I'm going to refer this to you, Deanna. Can people test positive more than once, or if you get it, do you become immune?
That's another area that we're still not clear on. The WHO has said there's no guarantee that you do develop immunity. So it is possible, but still we don't have a clear answer on that. Certainly people can get test positive, from their own multiple times from that original, time they were sick, because again, the test is sensitive. But in terms of, a couple months from now, can you get sick again? Again, we don't have a clear answer, but it is definitely possible.
Yes, as we mentioned earlier, we don't have a manual on this, but we're learning new things about this virus every single day. Originally, we first thought that this was not as contagious as the flu. Big mistake. It's far more contagious than the flu, and it's spreading more rapidly. So as we go along each and every day, we learn something new. We learn a different situation, and we try to deal with it as the best as we possibly can. Any update on public golf courses and tennis courts? Yes, we're working on getting those open. We recognize that people need exercise. We recognize that many other communities around Fairfield County some haven't even closed their golf courses. I know a lot of the private courses are still open. Tennis courts. We're looking to see how we can do that, but do it as safely as we possibly can. We're looking to open all our facilities eventually, but with limitations that are still going to provide for public safety, social distancing. And I know that I've been contacted about the tennis courts and the golf courses in the past, because as I've stated, many of our surrounding communities have either not closed some of their courses or they've reopened them. And we're looking to see, I think you can probably expect an announcement within the next day or two. So thank you. Thank you, Chris. Brian, what are the age ranges of people testing positive and people dying? Deanna, I'm going to give that back to you. I know the governor puts that, there are graphs on the state website. I think we put those graphs out as well, but Deanna, could you kind of respond to that?
We do. So in terms of Norwalk, we've had deaths ranging from 20, up to 80 and older in terms of the deaths. We definitely see more people who are 80 and older dying, as well as people in their 70s who are dying. In terms of actual cases and the ages of positive cases, we're seeing a whole range from 0 to, again, over 80. So we're seeing cases from all different age ranges. We're seeing a lot of people in their 30s testing positive. We're seeing a lot of people in their 50s testing positive, in their 40s. So it's impacting all ages, but we're seeing in Norwalk specifically, we're seeing a lot of people in their 30s, 40s, 50s, 60s testing positive.
Thank you, Deanna. I have one more question here, and it is, it's from Debbie. Do police officers have to wear masks in Norwalk or other places? I've seen so many videos online of police officers not wearing masks or gloves. The rule is that if you can't maintain physical distancing in public, you should be having a face covering. A lot of times, first responders, when a police officer goes to an area where there may be not able to maintain a physical distancing, they do have personal protection equipment that they can wear. But you may be referring to sometimes when you see a police officer on extra duty job, they're not within 6 feet of anybody, and they're not wearing a mask. Based on the governor's regulations about wearing masks and face coverings in public, they're not required to do so. But again, we encourage police officers to take the same universal precautions as everybody else. If they can't maintain their physical distancing, then we ask them to wear masks and so forth. So that's what I have there. I think I missed a question. Somebody said, what am I looking forward to this summer? I might have erased that unintentionally. What am I looking forward to this summer? Getting out, getting some fresh air, easing some of the restrictions so other people can do the same. Looking forward to seeing that light at the end of the tunnel get a little bit brighter, to turn that dimmer switch up so that we can see that light getting brighter and brighter, because when that light starts to get brighter, people start to feel better. People see something happening and they get encouraged, and it's actually kind of exciting. So that's what I'm looking forward to this summer. Morgan said, is it really going to snow this weekend? Unreal. Well, I don't know. It's probably going to snow. I think it was north of I-84 with some perhaps accumulation. It is unreal. What this phenomenon is all about, I do not know. Are fewer cars on the road and fewer people going into work, creating fewer greenhouse gases and making the environment fresher and cleaner? I had somebody that I was talking to the other day, and they said, when I go outside, I can smell the air. It smells so much fresher. So it could be an indication that we as human beings need to rethink how we do things, and we need to um, uh, be more conscientious when it comes to alternative fuels and keeping Mother Earth safe, because Mother Earth is all we have. She'll keep us safe if we work hard to keep her safe. So thank you for that question. I've got a couple more. Kevin says, have you come up with restaurant opening guidelines? I hope this was not asked before. No, it wasn't, Kevin. We're kind of working with the state on that. I know the governor is talking about opening outdoor dining for restaurants. We're going to follow the governor's rule on that. But if there's outdoor dining and if restaurants are allowed to open, there will be social distancing requirements. I'm sure the servers will have to wear proper face coverings. But this is going to be a slow but steady progress of getting things open. Nothing better, I like going out to the restaurants in town and sitting down and enjoying a wonderful meal. We have so many wonderful restaurants in the city of Norwalk. I know, Kevin, you have a restaurant too. So yeah, we're going to do the best we can, but the governor will be kind of guiding us in that area. We have Tracy, thank you and God bless. Thank you, Tracy, and God bless you. And thank you for tuning in. It's really important, and we hope everybody's getting some good information on these town hall meetings. It's kind of interesting because these town hall meetings can be informative, and it's a good way to reach out to the public who may not be able to get to some of the council meetings. So we're going to give serious consideration that when we do get back to normal, perhaps having a monthly or every other week town hall meeting, so we can reach out to the public and be available to the public, because that's who we work for. Erica, are we going to have mass testing here in Norwalk before we are open, including antibody testing? Deanna?
Sure. So I know that the state is working on increasing the testing capacity, and they have set a goal to be able to do 42,000 a week. It's almost about doubling what their current capacity is statewide. So they're looking closely at that. They're working on it. They're working with the labs to see how they can increase their capacity. So more to come on that. That's a question we get a lot, and we're eagerly waiting to hear more information about that as well. So hopefully within the next week or two, we'll get more information, but absolutely the testing capacity needs to increase.
Yes, so again, as I mentioned, that's going to be, some of those things will be determining how we can move from one level to the next safely and without jeopardizing our community. Last comment from Kevin, who asked about the restaurants. We are all hurting. I know that, Kevin. We really are. We appreciate that. We appreciate all the restaurant workers who are doing the takeout curbside service. Don't forget to thank a nurse. I think starting May 12th is International Nurses Day. These nurses, doctors, medical professionals are out there saving lives, helping people. I know for a fact some of the good things that they're doing. They are putting their lives on the line as well. They're away from their families. Some are quarantining because they're afraid of bringing it home to their family. I want to thank the grocery workers, the people who are out there. And that's why I say it's so important to the stores and the people who go into the stores to help keep them safe too. They're out there working every day, providing us the essentials that we need. Nobody bargained for this. I want to thank the people in the pharmacies, all the people who provide the essential services when we're in need. So it is now 6:45. I have no other questions. I do want to thank the people for tuning in. As I mentioned, I do have to get on another meeting that I have to prepare for. But again, thank you, Deanna, for being here. Thank you for all that you're doing. Your answers were spot on. I appreciate it. I also want to let you know that Monday night, coming up, I will be doing the meeting that I was supposed to do this past Monday. My guests will be Senator Bob Duff, who's always on social media and giving lots of information to people, and the police chief, who will be answering any questions you may have relative to criminal activity and other kinds of things, and some of the things that that'll be a good time to ask about the police officers wearing personal protection equipment and so forth. So again, thank you, Norwalk. We are Norwalk strong. We are going to get through this. I thank all the people who are being so responsible and so diligent. For the people that may need a little nudge now and then, please keep your physical distance, wear your face coverings, be responsible, be patient. We will get through this. Thank you, Norwalk Strong, and thank you all. God bless and good night.